Troop Patrol is a group of retirees who are concerned about the health care and Medicare and the new Obamacare that's out because it will benefit them in a large way.
I am a retiree who's here working as a political advisor with 1199.
I'm right now working on a owned list, and I'm with Senior Patrol. I have a visual impairment.
I am in this because I want to make sure that President Obama gets back in office to finish the good job that he started. We're so dependent on what he's doing, and I want to make sure, for the sake of my children and grandchildren, that they will have the legacy to carry on.
I found out about this, ironically, through someone canvassing, knocking on my door, and basically giving me the same spiel that I'm kind of giving everybody else. And I said to them, "You're preaching to the choir," because I'm for helping people. I'm for anything I can do to assist. My background is social work. It coincides with the work that I'm doing here.
I actually came up with the concept of the Senior Truth Patrol as a result of working with seniors, trying to protect Medicare, Social Security, Medicaid. These are issues that are important not only to our members, but also to seniors in the community, whether they're Republican, Democrat, Independent.
Approaching retirement, I would like to be assured that when I retire, that if God forbid, if I had a medical need, that I wouldn't be hesitant about being able to go to the hospital or go to the doctor to receive the care that I need at a comfortable fee.
It's up to us, not only for the election, but beyond the election, to have seniors out there telling their stories and telling the truth about these programs.
The Troop Patrol is basically just a group of retirees that are basically just trying to spread that news and allow people to know that their concerns and everything.
We're going to show you around, see what we do in different sectors in the office. This is our impact organizer, which we consider as a 501c3 office, meaning we don't do anything here C4 organization speaking about Obama.
One particular woman I can remember in Riviera Beach who was a supporter of Allen West, very, loved him in every way, and we got to talking, and she was saying she met him, and then she stopped and she said, except there are two issues that I don't like him about. And I said, well, what are they? And she said, well, I don't like his stance on Social Security, and I don't like his stance on Medicare. And this is right after the Ryan budget came out. And I said, oh, it's interesting. She said, yeah. She just went into her story. She said that she didn't want to go back into the private insurance pool. She was frightened about that.
Having been in the system for a long time and paid my taxes and worked and everything, you would like to be comfortable when you go into that retirement stage, knowing that your health issues will be taken care of. It's important to me. It's important to the Troop Patrol and the retirees. It's important to 1199 SEIU. It's just important for everyone.
She said that she lived in an over 55 community with a lot of widows, and she did not want to see any benefits cut in Social Security because they could barely live off of what they were, getting in terms of a benefit check. And I said, I agree with you on those issues. And she said, well, I'd like to keep in touch. She didn't know who I worked for, who I was, but she handed me her card. And it turned out that she was a Republican committeewoman from Palm Beach County. And that said to me that these are not partisan issues.
Here we do education, and we basically focus on the house meeting, leaders, create leaders in the community.
It affects me to the point to where I see the work that they have to do in order to convince people and allow them to know how important it is to have affordable health care. You would think after working most of your life that shouldn't be a problem. But when I see the retirees come in and I see all the hard work that they do, when I see them having to get on the phone and phone bank, when I see them go out and canvass and knock on doors to just explain to people how important health care is, I don't think that's something that should be a no-brainer. That shouldn't be something that you have to go and discuss with people. It should be something that's automatic. Living in today's society and having worked most of your life and everything, it's almost like you have to go out and ask someone for affordable health care, and you shouldn't have to do that. So I guess that would be my personal involvement right there, just working around these retirees and seeing the efforts that they have to put in to make people aware of their needs.
I know that I do not want to lose Medicare, because that is so vital. That is working for me since I've retired. That is uppermost on my list right now. And I don't look forward to getting a voucher. I do not need to have a voucher in my life. I need to have my Medicare. I need to have my Social Security check. And I do not want to lose that. So I am here working hard with the other retirees to push them and get them in the right direction.
We're going to do canvassing within my neighborhood.
Canvasser's office, which Rob Kelly is the director of the office.
That's everything.
And we also have John Tracy, and this is one of our super canvassers, Sandy. And what they do here, they do door-to-door canvass and get people in the community.
We're going to be going out and knocking on doors and making sure folks know the issues.
Probably the most common myth that gets told over and over again is the $700 billion cuts to Medicare. In the vice presidential debate and in the presidential, it's come up several times. And the truth around that is that the $700 billion was actually an overpayment to Medicare Advantage programs that was taken back. So it was something that is cut from overpayment to insurance companies, and it's reinvested into Medicare. So it actually extends the life of Medicare. There's so many things that seniors, when we're listening to the debates or we're getting mailers in the mail or we're, on the street, there's so many things that they talk about. And it's not, they're not out there to be gimmicky or partisan. They're not they don't hold up, signs that say, Mitt Romney eats puppies or anything like that. These are factual statements.
This is, of course, our Beverly, the number one in the office. Always come here early in the morning and leave late at night, making calls, connected with the retirees, etc.
There's an organization that I'm involved with called the Braille Club, and we've had a couple of parties over there already where we came and talked about the issues. One of the major issues for me being visually impaired is making sure that the polling places have the accessible voting machines online. And the accessible voting machines, it's one per voting place, and they are audible. So in other words, someone comes in who is visually impaired now, they don't need someone writing in who they want. They're free to vote for whoever they want on their own and by themselves. And that's a major step. That's a major step for the country getting these in.
This is our member-to-member office, and those reach out the health department, go to nursing home, assisted living facilities, hospital, and they don't go out there recruiting members.
A lot of them have grandchildren. And when you talk about voucherizing Medicare, and it won't affect them, it does affect their children and grandchildren.
And I think that's important. Just down the line for your kids and for your grandkids.
I know that the health issues that is so vital. My granddaughter, who's in college now, I want to make sure that she remains and has coverage until she finishes, and that until she gets a job. The Senior Troop Patrol that we're on right now, this mission that we're on to help the other seniors to get on target and to get the word out there that we're not going to tolerate any nonsense from the government when they start issuing vouchers and cutting all the benefits that we're supposed to have. We do not need that, and I want to empower all the other seniors to let them know that we've got to join forces and stand up for this. Most of us at some time or other have had sick relatives, or we have been sick ourselves, and it's so reassuring to know that we have the benefits in place. Take that away, take away fair housing, and we might as well be in the poor category and fall along the wayside, as Mr. Romney is suggesting.
Here we consider it as a war room. At 1 o'clock every day, all the canvassers came, and this is where we have our leadership training, prepare them and make sure they get the right education before they go out there to reach out the community.
They want to make sure that people understand that Social Security is not welfare. This is basically it's a social insurance program that we all pay into. They want to, they have ideas about how you would strengthen it. One is to raise the payroll cap.
This is a little office, but we are very excited, very ready to go, and especially we want to make sure that everybody in the community know that it's urgent and important for them to go to the poll.
These are not issues that are going to go away after the election in November. These are going to be things that we constantly need to be talking about. We need to be bird dogging who's ever elected into office to make sure that these vital services are not cut. There are many ways to strengthen them, and that's what the Senior Troop Patrol is all about.
As of the 27th, which is considered the first day of early voting, we will be having a great event at the library in Delray Beach. We invite everyone to come to join us to make sure that we vote.
Since I'm a recipient of the program, I'm very much concerned about the future of the way things are going in our country, and I want to see Obama get 4 more years, because he needs a full opportunity. It was such a mess 4 years ago. The whole thing, Social Security, the economy, everything was such a mess. And Obama is the beginning of our future, of our kids, of our grandkids, of their kids. And if we could just keep it on that same path, then this whole thing will turn around.
Thank you and have a great day.
I love it.